What you're about to watch is a clip from yesterday's live stream where my Mexican wife, who's a physical therapist here in Mexico, explains the differences between the public and the private healthcare system in Mexico and her experience with it. And keep in mind, she has a lot of friends who are doctors and who also work in the medical field as well. So there's private health insurance or public health insurance. And if you're a resident, you can get public health insurance, which is going to be a lot cheaper, but it's not going to be as high of quality of care and it's not going to cover as much stuff. It says it covers everything, but it really doesn't.
So again, it depends. As he said, the public health insurance, it's gonna be like super cheap considered to what you paid for private insurance, like health insurance. However, unfortunately, the public hospitals are treating like most of the part of the population. So unfortunately,
They're really busy,
they're really busy.
overworked,
Exactly.
don't have enough
And
machines, don't have enough
they
medications.
don't have enough of anything, basically. And obviously they are always getting a priority to the most complicated cases, and as I mean, they had to do it, if
Yeah.
there are not a lot of resources, they have
Yeah.
to prioritize to the most complex cases. And again, if something's happening to you, for example, you're having a really bad stomach ache or any kind of condition that it might not be putting your life in danger, but you go to the public hospital, again, there's the triage. So how bad you are or how much that condition complicates or put your life in danger, and you are gonna have to wait probably 3 to 6 hours to receive medical attention in the public hospital. And again, probably you will have to stay there in the hospital, and probably you won't, but in that meantime you have to wait a lot. And if you go to a public hospital, obviously it's way more expensive, but you're gonna receive immediately
A private hospital.
a private hospital. It's gonna be way more expensive, but you're gonna receive
Care
medical attention
immediately.
like immediately. You don't
Yeah.
even have to wait. So again, it has its pros and as it cons. If you're just having something like a flu or something minor, there are even free services at the pharmacies for medical attention. But again, if I prefer to cover my
Private healthcare.
private healthcare,
Health insurance, yeah.
because I mean, the specialists or the private doctors can be really really good, but again, it can be really expensive.
Uh-huh.
So obviously, if I get a broken bone, I would prefer to have attention at private hospital than a public hospital. Again, because it's so different. So talking about orthopedics, that is something I know the most. So if you go to a private hospital and you have your medical insurance, you're gonna be able to have more like the most recent surgical techniques, and obviously that's gonna be a faster recovery, and they cover your physical therapy, blah blah blah. If you go again, if for the same case like a broken bone, you go to the private hospital, most of the time are older techniques because they don't have the equipment to that it takes to have a minor surgery, a minor invasive surgery. So you're gonna have like a higher how it's called, la herida,
Oh, a scar. A bigger
a
scar.
bigger
a big.
scar, a longer time of recovery. For example, I have patients that they have the private insurance and it never send them to physical therapy, so they have to take their physical therapy
You
sessions.
mean the public insurance?
Yeah, the public insurance. So it's again, there's a lot of people that need physical therapy and they're unable to cover all the cases. So if you have an orthopedic case in the public hospital, they're not gonna send you immediately to physical therapy. So most of the time my patients have to pay for a private physical therapist, and when it's time to be sent to physical therapy at the public hospital, it's like 3 to 6 months later that after you got your surgery, which is a lot of time. So everything's way slower in the public hospital.
Or and
So,
another example, like you have private health insurance, and let's say you eventually ended up developing a kidney disease and needing dialysis, for example. If you had public health insurance, well, then you might not get all the dialysis treatments that you need. They might be cutting your treatment short because they're overloaded and they have more patients than they have machines to treat people. Is that right? Is
yeah.
that accurate? Whereas if you have private health insurance and you eventually end up developing a kidney disease, well, then you're going to be covered for all of your dialysis treatments that are needed at private dialysis treatment places, right?
And again, everything is more invasive. So I'm going to talk about something really, really personal that I haven't talked about much. Uh, my uh, my grandfather started having kidney failure, so his kidneys stopped working in October of this year, and he has public insurance. And when they told us that he needed the dialysis process, uh, because that's what the doctor at the public hospital suggested, to have the dialysis. And my grandfather has always been treated like in public hospitals, but also in again um, like
Private
private
hospital?
hospitals. And obviously he doesn't have a private insurance.
No.
But anyway, so we talked with his cardiologist, which is private, and he said, you know what, because of his age and all the things that he already has, I really do not recommend to have the dialysis because of this, and he gave us all the reasons. And obviously we went back to the public hospital and they told us, you know what, there's no possible way to have hemodialysis, which was what the cardiologist suggested. And
So the cardiologist didn't want you to do dialysis. They wanted him to do hemodialysis or
yeah,
whatever that's called.
yeah.
And then at the public hospital, they can't do. They
they
can
can't
only.
they can't do hemodialysis because they don't have enough machines or whatever to be able to offer to my grandfather an hemodialysis. So they say obviously he has a kidney failure, his kidneys don't work anymore, but we can't offer you the best option. We just have this one. You take it or you don't take it. And obviously my mom was like, because they say that first they have to put a like a catheter or something inside
Mhm.
of his like the abdominal cavity, and the cardiologist was like he's in a really high risk of not surviving to that surgery, so we recommend something less invasive, that just putting the catheter outside that goes straight to the heart. And again, my family started talking about it and we were like, you know what, obviously we're not going to put his life in danger. And my mom has to sign a paper at the public hospital where they refused to receive the treatment that they were offering, that in this case was the dialysis.
Hmm.
So right now my grandfather is receiving the hemodialysis, but my family is paying for the session and he's taking it outside. So sometimes, even though you might have um, like something that it's gonna be easier, or it won't have a cost being treated at a public hospital, sometimes you will have to use a private attention. So I don't know, I mean it depends. There are some cases, my grandmother had a surgery, abdominal surgery, and she got it again at the public hospital, and everything went well.
Mhm.
But again, it just depends on the cases.
Okay.
Yeah. But again, if you ask someone that lives here, we are all of us so scared about IMSS. We've heard about so many bad stories
Eam-
and horrifying stories
she just
that
mentioned
it's like
Eames. That's this.
nobody wants this. So again, it has a lack of everything, like equipment, medicine, personal, everything. So they attend like most of the population, and it's impossible to cover everything. So the attention, it's very deficient as well. It's very cheap, but it's very deficient. So